Dysphagia is the medical term for difficulty swallowing. Dysphagia can occur from several different things that range from relatively benign to very scary things like cancer. But to really understand dysphagia or difficulty swallowing and why it might happen, you really need to understand what happens during a swallow. When patients put food or liquid into their mouth, it starts, the digestive process starts with saliva mixing with food or liquid. The tongue then pushes that food or liquid into the back of the throat. Muscles around the airway close and opening over the airway so that food and liquid doesn't escape into the trachea or the lungs. The upper esophageal sphincter up high in the back of the throat actually relaxes to let food or liquid pass by, and then muscular contractions called peristalsis push food and liquid all the way down the rest of the esophagus down to the lower esophageal sphincter muscle. That relaxes, and food or liquid then can drop into the stomach, and a swallow is then complete. Patients who have difficulty swallowing usually describe food or liquid or pills pausing, hesitating, stopping, or emptying very slowly from the esophagus. Once we start conversing with patients about their difficulty swallowing, we will often find that patients who've had difficulty for a long time don't really appreciate the severity of their difficulty swallowing. They have often adapted and made what we term compensatory measures for their difficulty swallowing. They may do things like keep a bottle of water handy at mealtime to wash down their food. They may cut their food up into really excessively small bites. They may chew very thoroughly. And some of their friends may give them a hard time for always being the last person sitting at the table. There are lots of different causes of difficulty swallowing, but a stricture is one of the most common causes. A stricture is just a term for scar tissue that occurs in the esophagus. Scar tissue contracts or narrows over time, and scar tissue in the esophagus makes the esophagus more narrow, which then makes food and liquid, makes it more difficult for food and liquid to pass by. There are lots of potential causes for dysphagia or difficulty swallowing, but a stricture is one of the most common causes. A stricture is just a term for scar tissue, and when a stricture occurs in the esophagus, scar tissue contracts over time, and that makes the esophagus more narrow, which makes things more difficult to pass. A stricture is most commonly caused by reflux. Caused by really the damage and irritation of stomach contents regurgitating into the esophagus. But reflux is not the only cause of strictures. Patients can have an allergic condition in the esophagus thought to be related to food allergies called eosinophilic esophagitis. Strictures can also occur from prior neck or chest radiation. Some patients have difficulty swallowing simply from esophagitis, which is inflammation found often toward the very bottom of the esophagus. Esophagitis commonly occurs from reflux and is usually seen at endoscopy or EGD. Patients can also have an esophageal dysmotility, which is kind of a broad category for an array of swallowing disorders, but they all involve some dysfunction in the way the esophageal muscles or esophageal sphincter muscles squeeze and relax. It is important to know if patients have dysfunctional swallowing because part of the protective mechanism in reflux control occurs when someone has an effective swallow. They can actually clear their esophagus of the regurgitated material. But if someone has a defective swallowing mechanism, then they may reflux and have even more irritation and damage to their esophagus because the swallow won't clear the regurgitation from their esophagus. There are several other causes of dysphagia as well. Yeast infections in the esophagus, viral infections, particularly in immunocompromised patients, can also cause difficulty swallowing. Esophageal cancer is probably the most unfortunate reason someone might have difficulty swallowing. Dysphagia is what we term an alarm symptom. It is a symptom that should never go unevaluated.